Hi, my name's Dr. Sridatta and I'm a consultant obstetrician and gynaecologist in London. I'm also an ambassador for the British Medical Association Research Foundation. Over the next few minutes, I'm going to talk about what happens in a sexual health check. The first thing to say is that when you go to a sexual health clinic, everything is confidential. So your GP may not necessarily be notified. The types of symptoms that you might be experiencing that suggest you've got a sexually transmitted infection include any type of abnormal discharge, which could mean a change in the colour of discharge you're experiencing, or the smell, or in fact the amount of discharge you're seeing. You may also get abnormal bleeding, perhaps after intercourse, for example, or between your periods. Those are the key signs to look out for. However, even if you don't have symptoms, that doesn't necessarily mean that you don't have a sexually transmitted infection. So you can actually make an appointment to attend a sexual health clinic, or in some cases you can simply drop in. So there are some walk-in clinics that are worth exploring, perhaps via the internet, in order to look at their walk-in times, their opening hours, and where's near to you. So once you get to the sexual health clinic, someone will find out a bit more about you, the symptoms that you've been experiencing, and any medical problems or infections you've had in the past. They'll also ask about the number of sexual partners you've had recently and whether we need to contact them if results show that there is an infection. There's a whole host of tests that we can do in a sexual health clinic, and that can range from simple urine tests to taking swabs or in fact blood tests. And we should be able to do that at the time of examining you once we found out a bit more about you. If the results aren't available on the same day, we'll actually send this out to you in the post. You may not want to tell your partner or partners the results, but we can actually do that for you. It's called contact tracing. The important fact to note here is that most infections are curable, but whilst you're receiving treatment, which is usually a course of antibiotics, it's really important to make sure that you're having protected sex. Also make sure that your partner is being treated. So use barrier contraception and make sure your partner is fully treated, both of you are symptom-free, before you stop using barrier protection. This prevents you from getting reinfected with the same infection. So, just to recap, today we've talked about some of the common signs and symptoms you might experience if you have a sexually transmitted infection, how to go to a sexual health clinic, and the tests and treatments that they may provide you with. My name's Dr. Sridatta, and I hope this has been helpful.